I request Dr. Uday Zakaria to step up on stage and give his presentation.
So maybe while it's coming on, my job over the next few minutes is to show you the CMC data on native liver survival in the setting of ALF due to rodenticide using low volume plasma exchange. So when we use the word native liver survival, native is our own or my own liver as opposed to a transplanted liver. So let's try to rescue our own liver versus trying to put in a new liver from somebody else. Next slide please. Vijay has shown you this slide and I want to highlight what Dr. Mangayakarisi said. Let's try and do it earlier. So for me and personally, on the left, point number 2, increase in the INR is what is the key. So I've been asked, how often do you check this increase in INR? We are suggesting at least do it daily. You may do it earlier, but at least over a day period, if there is an increase in INR, it tells you that the liver is not settling down. So people have asked me, is it too early? So I say better early rather than late or never. So time will tell us that, but that's an important point I feel. Next slide. So this is Leenath's work from pediatric hepatology from Velo. This was the initial work which showed. So we looked at all children less than 18 years of age, as you can see, and those who met the criteria of acute liver injury and acute liver failure, and further very sick who met Kochi criteria. None of these patients had access to liver transplant at that point, and if you look on the right of your screen, you can see that the 1 month survival, and here in acute liver failure, 1 month survival is equivalent to lifelong survival. So that was 75% in this small group. This was the initial work which gave us hope that this therapy may work. And this was all low volume plasma exchange using the centrifugal technique. Next slide. Vijay has shown you this. I'm highlighting it again. When expanded to include all adults, and of them 32 of these fulfilled the very sick Kochi criteria, which otherwise none of them would have survived with standard medical therapy. And here that number of survival, 1 month survival, was now close to 70%. And Vijay showed you as a predictor, an easy predictor was the bilirubin fall of more than 20%, which had a 90% sensitivity and specificity to predict survival. Next slide. With this, Dr. Kausala, who spent some time, 1 year with our unit, she's from Sri Lanka, and she, along with the rest of the team under Dr. Epan and Ashish Goel, looked at a meta-analysis looking and seeing whether plasma exchange actually improves survival in acute liver failure. And as you could see the forest plot, it was favoring PLex, and when looked at carefully, it was in a group with a single etiology. So either single etiology like rodenticide or Wilson's disease, when you looked at a single etiology with PLex, it certainly favored PLex. So this is just to show you overall that PLex in our experience does have improve native liver survival in ALF. Thank you. That was my last slide.
Thank you, sir.